is known by many names. Up in the north of India, people refer to it as eye flu, whereas in south it is referred to as Madras eye, and sometimes it's also called as red eye or pink eye. So this is a seasonal infection of the eye, commonly caused by bacteria, but can also be caused by virus. The important thing about it is highly contagious and it can very easily spread from one person to the other. The mode by which it spreads is by the droplets which come from the patient's eyes. So people ask me, doctor, will this droplet jump from one person's eye to another? No, it's not like that. It's handling the areas which this person has touched. For example, a door handle or a tap, water tap, or a toilet flush, or the handle in a bus, the rod with the supporting rod in the bus. So anywhere the infected person has touched, the germs, that is the bacteria or the virus, would be there. And so another person touches that area and he touches his own eyes without sanitizing the eyes. So that's the way the infection spreads. So from the infected areas, another healthy person touches the area and then transfers it to his own eyes by his own hands. So the one and most important way of preventing this is not to touch your eyes during this season, and if at all you need to touch your eyes, always wash your hands with soap and water or sanitize your hands before touching your eyes. So some of the don'ts which could help you is try to avoid crowded areas. Be very careful when you use swimming pools because if a person with an infection has entered into the pool, most probably he can transfer to other people. And as far as possible, don't touch your eyes, don't rub your eyes. Always keep a sanitizer at hand. Always wash your hands before touching your eyes. And if you have a red eye or a pink eye, try to avoid public places and contact till you are better. Generally, this is a self-limiting condition. It would just recover in about a week's time. Sometimes it takes longer, especially in people who are diabetics or people who are on some other medications called steroids. It may take a longer time. In rare cases, there could be other complications where the infection could spread to the cornea, which is the black portion of the eye. In those cases, the vision can get affected. Otherwise, generally, this is self-limiting, nothing to be worried, and you just have to take care of yourself and prevent yourself from getting infected. If at all someone in your family gets infected with the eye flu or the Madras eye, isolate the person as much as possible. Give him separate or personal items like towels and plates and pillow covers, so that it does not mix with the other healthy members of the family. Especially if there are elderly, very small children, or people with diabetes and other conditions like kidney problems who have lower immunity, we should keep those people away from these people who are infected. In general, antibiotics can be used when there is a severe infection. Antiviral may be used in some cases, but in most cases it is self-limiting and it will mostly go off by itself. So there is nothing serious to be worried about this.